Okay, so I think we're going to get started here today. My name is Emily Lemiska, and I am Director of Communications and Educational Programming for U.S. Pain Foundation. I'm going to be emceeing our webinar today. We're very excited to have Dr. Jeffrey Fudin here with us to talk about telehealth, and we really want to make this webinar as useful as possible to you, which is why the bulk of it is going to be a Q&A, and it's going to be open to your questions. I also wanted to note that Zoom is having some difficulties today. I don't know if you've maybe heard of that already. They've had some outages, but we seem to be working correctly right now. So just bear with us in case anything happens. We have another staff member on deck to help out as needed. We also record all of our webinars, so we will post that to our website if for some reason you get dropped off. And the other thing to note is that if you have difficulty connecting on your computer, what we've heard is that smartphone devices and tablets seem to be working a little bit better. So feel free to try that if you're having any difficulties. So the agenda for today is, welcome and some housekeeping items with me. Then Dr. Fudin is going to give a little bit of an overview of telehealth just to sort of set the stage for what we're talking about today. And then we will open it up to our Q&A. And a lot of folks already submitted some great questions, so we'll try to get to those as well as any questions we have live. But please know we might not be able to get to absolutely everything today. So you may have noticed just some housekeeping items. Attendees are on mute and your cameras are off. We will take written questions. So at the bottom of your screen, you should see a little Q&A icon. You can click on that and type in your question and we will see it and take it from there. If you're tuning in from Facebook, just type your question into the comment section and we will pull in some questions from Facebook as well. Again, we might not be able to get to all of our questions today, but we'll do our best. I also wanted to note that, we really can't answer questions that are very specific about your health situation. So if you can sort of try to generalize your question, because obviously Dr. Fudin can't really give you specific medical advice, as he's not your clinician. Again, also, we will be recording this and it will be available on our website in the next day or two. So if you need to jump off for any reason, you can definitely check that out later. I also wanted to thank our sponsor for today's event. They've generously supported this educational effort, so we really appreciate Salix. Thank you so much for your support. And with that, I'm going to introduce Dr. Fudin, who we are just so lucky to have today. And I'm going to read through his bio. It's a little bit long, but honestly, it's so important. It'll just give you kind of an understanding of just how much of an expert he is in pain care. So I think it's valuable to know. So Dr. Fudin is the clinical pharmacy specialist and director PGY2 pharmacy pain residency programs at the Stratton VA Medical Center in Albany, New York. He is also the CEO and founder of Remitigate Therapeutics, a virtual pain management consulting firm, and owner and managing editor for paindoctor.com. So Dr. Fudin is clearly very technologically, ahead of things here. Dr. Fudin holds adjunct faculty positions at 2 colleges. He also serves as section editor for pain medicine, co-editor at large for practical pain management, senior editor for pain medicine, and as a peer reviewer for several professional journals. In addition, Dr. Fudin is the founder and board of trustee for the Society of Pain and Palliative Care Pharmacists, where he serves on several committees, and is a diplomat to the Academy of Integrative Pain Management, as well as a fellow to the American College of Clinical Pharmacy, the American Society of Health System Pharmacists, and the Federation of State Medical Boards. Dr. Fudin is a prolific lecturer, writer with over 300 publications, and researcher on pain management topics. So hopefully you understand why we're so lucky to have him here today. But above all of those things, Dr. Fudin is definitely an advocate for patients, and he's very passionate about helping people. So we are very honored to have him with us. So with that, Dr. Fudin, welcome, and I'll let you take over sharing your screen. I'm going to turn my camera off, and then I'll pop back in once it's time for our Q&A.
Thank you so much, Emily. So I would like to thank everybody for joining us today, especially on the first day of school. Some of you may be busy with children or grandchildren. So I do appreciate you taking the time out for this. I'm going to pull up some slides. And Emily said I was tech savvy, so I hope I don't lose you guys. That would be embarrassing.
Looks great.
Okay, so the topic that I was asked to speak on is pain during COVID-19. And really, this program is for you, it's me, right? So I'm just going to give you a kind of a broad general overview of some of the issues. And I'm going to spend about 10 or 15 minutes going through some items that I think would that fit nicely into this topic that you should all be aware of. And then after that, we're going to leave time for guys, and I'll show you how that's going to lay out. But to start with, the objectives that I'm going to speak about, I'm going to describe and differentiate between phone and video options because they're a bit different, obviously. Understand the federal opioid prescribing regulations and telehealth and the convenience and safety initiative that has been basically fostered by HHS and Medicare due to COVID-19. And they could actually change some of these regulations and rules and policies for any emergency situation. COVID-19, the example that we're all living right now. And then lastly, I'm going to summarize some important and necessary confidentiality parameters that you all really need to be aware of with regard to virtual office visits, including HIPAA violations, the privacy of your records, your home, that sort of thing. Certain things that need to be considered when providers and patients are involved in video conference platforms. If you're sharing documents, decide you want a text message either on telehealth and or with your pharmacist. So then we're going to open it up for Q&A. And I'm just going to throw out some questions, but I've already seen, based on communications with Emily, that nobody's been shy about submitting questions. So there's been some very good questions, but some potential topics might be identify issues surrounding urine drug specific to COVID, because how do you do a urine drug screen virtually? Better question is, how do you do a witnessed urine drug screen virtually? And then clarify issues and concerns with patients with regard to if they're taking immunosuppressant type drugs for rheumatoid diseases. There's been a lot of chatter about NSAIDs basically making the risk of contracting COVID worse. That is a fallacy. And also ACE inhibitors and ARBs, those are certain kinds of blood pressure medicines that people are frequently on, also have an effect on your defense to letting the COVID virus into your body. So those are issues that come up actually quite often. So here's how we're going to do it. To give you an intro, some background, as I said, total time 15 minutes from the time I started. And then what we're going to do is we're going to combine these two issues here. Rather than do a Q&A, we're going to have participants describe various issues they may be having or things that have come up either with themselves or family members, and we'll combine that with the situational kind of Q&A live time. So pain patient items. First of all, you need to be sure if you're involved with telehealth, you need to be sure that all communications in writing or by text are encrypted. And a lot of pharmacies, particularly chain pharmacies, are doing this now. It's not like it's a direct text message that has to sign into a text portal, and that's fine. And use if it can't be encrypted, then you should use initials, and you shouldn't be specific between providers like an emergency situation. It would be okay temporarily if it's an emergency, but you shouldn't be using names. That stuff is all trackable. Now, there are certain systems that are encrypted so that it's hard for people to basically, bust into the platform and steal any information. Citrix is a very popular system. Dropbox is encrypted, so that's good. And then there's a thing called One-Touch Telehealth. So they all meet the HIPAA rules. And in order for a provider to ensure that they are following those rules, and if you want to know if they're following those rules, they should have a business associate addendum certificate or a HIPAA BAA. Now, interestingly, even though I love Zoom charges $200 a month for providers to have that encryption certificate. I don't know that the encryption or the safety is any different than it is for what we're doing right now. If you have to sign in with a password, but that might dissuade certain providers from using Zoom. And you may wonder, why aren't they using Zoom? Well, this may be the reason they're not using Zoom, because it's $200 a month. Microsoft Teams is becoming a more popular platform, and that is HIPAA compliant. And then there are many others also. So there are options, but I think that it's very important to maintain privacy. Stay in touch with your medical provider if you have COVID-19 symptoms. I cannot stress this enough. All right, prevention is very important. Coughing can worsen with all kinds of pain, especially back pain. So if you're coughing a lot and you've got COVID or you don't have COVID, coughing can cause back pain to be worse. It can affect the intercostal muscles, which are just below the chest line, and it can increase facial pain. So all those are important. And of course, the virus does come with muscle aches and pains, general weakness and malaise. So those things are problematic. And with quarantine and extended rest, that can set patients back in terms of their activity. Now, I think it's also worth mentioning, if people ask me all the time, if a patient has COVID-19, what are the other risks? Well, the risks are that if you're on certain cough syrups, that's problematic. If you're on things like cyclobenzaprine or carisoprodol, the brand names are Flexeril or Soma. Those can make you drowsy anyway, and in the face of the virus, that can be worse. If you have a fever, that's potentially problematic with patches, with transdermal patches, like fentanyl patches or buprenorphine patches, because the absorption of those drugs increase through the skin if you have a fever. So there are all those issues. Another issue comes up sometimes is if you're on ibuprofen, you're on acetaminophen regularly, will that mask the signs of fever? Well, yeah, it'll mask the sign of fever, and you may miss the first sign of being exposed to COVID. Now, this slide is probably impossible to read, so it's hard for me to read. But I put the reference in large text on the bottom. I encourage you guys to go to this website and print this out, or at least have it handy if you have questions with regard to refilling controlled substances during the COVID pandemic. What it is a schematic tells you what your prescriber can do and what they can't do under certain circumstances. If yes, then it brings you through, up here it says yes. And then if yes, what can your practitioner do? If no, what can the practitioner do? What can you do? What about delivering it to the pharmacy and all that sort of stuff? So again, it's hard to read this, but it'll pop right up if you go to the website. And I thought if you saw the schematic, you would recognize it when you go to the website. Regulation, federal versus state. So without reading through all this stuff, I'm going to tell you the stricter of the two laws prevail. So there are federal regulations that have been put in place aside from the COVID pandemic. But then after the pandemic came along, the Coronavirus Preparedness and Response Supplemental Appropriations Act, also known as the CARES Act, came into place, and Health and Human Services waived certain Medicare coverage for telehealth. There are certain things that have changed with regard to the DEA and allowing supplies of medications. But again, certain states, although a lot of states have put this in place, some states have not lightened up as much as others in terms of early refunds. So in summary, telehealth is available by phone and video options. There are state and federal regulations regarding prescribing of opioids and other controlled substances, and it's very important to secure confidentiality. I mean, those are some of the key issues I wanted to bring forward in the first 15 minutes. So now that we're at that 15-minute mark, we're going to open this up for questions and participation with the audience.
Thank you, Dr. Fudin. So that hopefully was a good little overview of telehealth and some of the key considerations for you as a patient when seeking telehealth appointments. So just a reminder that you can type your questions into the Q&A icon panel at the bottom there. We also have some questions coming in on Facebook. We also had a lot of folks who submitted some great questions in advance over email, so I'm going to jump into a couple of those first. So one question was, what equipment do I need to do or need to have for a telehealth visit, and will it work with Wi-Fi?
So great question. Yes, it absolutely will work with Wi-Fi, and I encourage that, because if you're one of those people that doesn't have unlimited internet time, then you're not going to get charged that time if you use Wi-Fi. So yes, definitely use Wi-Fi. Yes, you can use a smartphone. So if you have a smartphone, that's good. If you got one of these old flip phones, it's not going to work. All right. So a smartphone is good. Any smartphone, or a laptop that has a camera on it. And almost all laptops now do. Now, if you've got one that's 15 years old, it might not have a camera on it, but you can buy a camera, very inexpensive, that clips to the top. If you have a PC and that does not have a camera on top, again, most of the newer ones do, but if it doesn't, and it's a flat screen, then you can get a microphone and a camera that will clip to the top of that. If it's one of those old-fashioned screens, get a new one. Okay, but if you can't get a new one, there are also cameras that are on little tiny tripods that you can put right next to your computer, and they're expensive. They're probably less than $50.
Awesome, thank you. Another question we had was, how can a doctor diagnose me without actually doing a physical exam? And I think this kind of speaks to a larger question that patients might have, is sort of like, what can a doctor do over telehealth? Like, besides maybe prescriptions, like what other kinds of services can they offer virtually?
Okay, so I kind of have to break that question down because it really depends.
Okay.
There is some very sophisticated telehealth equipment now that can be brought into a patient's home, where patients can be monitored real time with certain devices. So, for example, we've got patients with Lou Gehrig's disease who are paralyzed, right? And we have equipment in their home that we can monitor all kinds of stuff through Dopplers that are hooked up directly to their computer devices. And so we can do vital signs, we can do blood pressure checks, we can check their oxygen levels, which we're very concerned about if they're on high doses of opioids and other sedating medications. So yes, there's very sophisticated equipment that you can use, but that has to be approved by the healthcare provider to pay for that equipment and that sort of thing. Now, I don't think that's the question that was actually anticipated. I think it's only fair that I answered the question completely. So I think what most people would be interested in is, how can somebody do a physical exam if they're like this, right? I can't do a physical exam on Emily here because I can't get to her. So, but there are certain things that we can do. So, for example, anybody that's been examined specifically for pain, you know, I might, that's kind of out of my scope, first of all, okay, because I'm a doctor of pharmacy, and so I do all the medication management, but sometimes I get sucked in, right? So I am part of the physical assessment sometimes. So you all know if you're in a physician's office, you're seeing an NP or PA, and you're a new patient, right? They're going to say, listen, I want you to take your foot and press up against my hand. I want you raise your arm and I'm going to press down. I want you to do this and I'm going to press this way. Does it hurt if you do this? Can you stand on one foot? Can you bend over? We can do those things on video health. It's actually entertaining. No, I mean, it's good. I mean, because I think that some people can actually perform better in their own home. It's different if you're in an office and you're freezing from the air conditioning and you got a gown on and you got people walking in and out. People are more comfortable in their own home. So to do a physical exam like this, it's really, there's certain things that we can't do. We can do pulse, or if you're with somebody, they can take your pulse. We can show that person how to take your pulse. So if you have a child with you, or you have a spouse with you, and you're not really that savvy, with electronics and somebody there, a neighbor, whatever, that's great. All right, they can take your pulse, they can take your blood pressure. If it's going to be a regular kind of thing, I might tell a patient, you know what, you're on a bunch of blood pressure medicines anyway. You need to go to the pharmacy and buy a blood pressure cuff. And some insurance companies will pay for that. You can certainly take your temperature, right? So there are certain things that certainly can be done. I might say to you, I want you to stand up, right? I want you to stand up and I want you to bend backwards like this and see how far you can go. And I want you to bend down and touch your toes. So there are things that definitely can. But I think that, certainly for follow-up visits, very simple.
Okay, great. So it's all about kind of being creative and,
Yes, absolutely.
Great. Okay, cool. That was a great answer. Another question we had is that, we've heard from a lot of people that they actually really like telehealth, sort of as you allude to. Some people do better at home. We know that people with pain often have a lot of mobility issues. We just did a survey that a lot of you responded to for Pain Awareness Month. It was like 1,600 responses. And something like 89.9% of people said that they hope telehealth continues after COVID-19 is, long over.
Yeah.
Hopefully that's soon. But someone asked, when COVID is over, do you think we're still going to have telemedicine as an option? Are there things that we need to do to encourage that to happen? Sort of, what do you think is going to come out of all this?
I think it would be great if it happened. I think that insurance companies are starting to see that this is very doable. The federal government has been doing this for years in the Department of Defense and the hospitals. It makes a lot of sense. As anybody that's participating in this knows. And I know for certain that HHS and CMS are looking at continuing these services. The waiver that they put in place on March 6th, I think it was on March 6th, it allows beneficiaries in any geographic area to receive telehealth service. So, I mean, that's tremendous. One of the people in the government are complaining about is that people on opioids, they need to see a pain specialist. And people say, well, there's no pain specialist near me. I have to drive 3 hours. And then if I go there and I come back to fill the prescription, the pharmacy is telling me, since why am I seeing a doctor that's 3 hours away and getting the prescription filled here? I don't want to fill it. So, I think that telehealth, first of all, is giving people an opportunity to real specialists. I mean, not a lot of pain specialty clinics have PharmD that spends their life doing pharmacotherapeutics, specific management. and pharmacogenetics and all the things that go along with that, toxicology screening. You know, there's not. But look, I mean, I'm here with all you folks. I could just as easily be working with physicians all over the country, and I do now. I mean, what COVID has done for me, it's actually made me so busy because, you know, I may be communicating with a patient and a doctor in Ohio, and I'm usually in New York, although today I'm in Florida. So yeah, I mean, the accessibility is absolutely phenomenal. You can tap into specialists all over the country. A lot of times doctors will say to you, well, you know, I don't feel comfortable prescribing your opioids chronically unless you see somebody in behavioral health. It doesn't mean that there's something wrong with you, but I think that you need that support. And then, you know, like, where should I go? Well, there's nobody that does behavioral health that specializes in pain management anywhere near you. You'd have to go like 3.5 hours. Well, are you kidding me?
Right.
But psychologists, clinical psychologists have been doing telehealth for a really long time, and they could bill for it. So it's all billable now. And I think that insurance companies are starting to see that the outcomes are actually great. I don't want a patient driving 3 hours to see me that's got excruciating low back pain, because by the time they see me, we can't do an exam or worse. And then by the time they get back, they're 2 weeks behind now because they're so bad. So I think that there's going to be continuation of this. You know, it's new for a lot of people. Insurance companies, I think that they saw fraud as a potential for telehealth. I'm not really seeing that at all. I think that doctors are more accessible at extended hours. I mean, a doctor for example, may leave their practice. It may take them 2 hours to get home in the traffic. So now they don't have to deal with that, right? Now they've got an office set up in their home, and their commute is from the bedroom to the couch. You know, so it's a lot easier for everybody, really.
Right. Yeah. No, it's great points. And that sort of ties into another question we were asked. This is a little more situational, as you had mentioned before. So this person said that they have retired. They now live in North Carolina, having moved from Pennsylvania. Their pain doctor is still in Pennsylvania. They travel there once a month, but they still get their prescription filled in Pennsylvania. The pharmacy here in North Carolina has refused to fill the Pennsylvania prescription, and she hasn't had enough time to find a doctor locally. It would be great to be able to do a teleconference and have them ship my medicine to where I'm at. So that's sort of like a complicated, you know, cross state lines, but sort of what have you seen, I guess, as far as, you know, being able to prescribe and sort of like mail order prescriptions over state lines? I know that's a complicated issue. It sort of varies by state.
Okay. Yeah. So first of all, during COVID-19, the federal law has lifted all of those restrictions across state lines, depending on the situation. In this particular situation, it's always been legal for a pharmacy to fill a prescription from the state. I don't think that that's what this person asking. I think that my understanding is that the pharmacist is refusing to fill the prescription because the doctor's out of state, and because it's been such a long period of time has gone by. I personally, I think that that's unreasonable. And the federal government has made exceptions, and depending on the state, states have made exceptions that you can file a complaint. Of course, you know, by the time the complaint is heard, it could be another couple months that go by.
Right.
So I wouldn't alienate the pharmacy or the pharmacist. What I would do is I would put on a mask, maybe 2 masks, maybe a face shield, and I'd go to the pharmacy and I would ask to speak to the pharmacist, and I would make an appointment in advance and say, you know, I'd like to come in and speak in person to the pharmacist and explain my situation. I'm not asking for any promises. I just want you to understand what's going on. In advance of doing that, I would contact the physician in Pennsylvania and ask that physician to write a letter. And in that letter, invite the pharmacist to call and speak to the physician and have the physician hopefully will be humble enough to say, I'll provide you anything that you need. We can fax you any information you need. This patient is in a difficult situation because of the COVID pandemic, and we are doing regular visits by telehealth. If you need transcripts for that, or you need notes, or you want the notes, we're happy to supply that as long as they're willing to sign a HIPAA waiver, right? Make an appointment with the pharmacist, go in with all your protection, hand deliver the note and say, this is my situation. I'm seeing a physician. The physician's in Pennsylvania, and I would want nothing more than to have a local physician. If you can help me find one, you'd be my best friend. All right. So time to get more bees with honey. The pharmacists have a liability also. And believe me, I spend a lot of time in court. So the pharmacists have high liability as the physician does, and they have, according to federal law, an equal and corresponding responsibility to ensure that prescriptions are filled are for a legitimate purpose. And pharmacist probably doesn't think that it's an issue anyway, but they're filling hundreds and hundreds of prescriptions and they don't want to take a chance. So that's how I would approach it.
Right. So anything you can do to sort of support your situation and have your doctor help provide some supporting information could be helpful. That is great. That is great advice. Thank you so much. And it kind of ties into this other question we had gotten, which I think is really important. And then we'll start getting to some of our live questions. But this was, can an individual establish pain care in a first visit if over telehealth? Like, have you heard of that being possible?
That is now possible.
Okay.
It did not used to be possible, but now, in fact, I may actually have the regulation here someplace.
Oh.
Hang on a second. Yeah, the CARES waiver, okay, allows benefits in any geographic area to receive telehealth services, to remain in their homes for telehealth, reimbursed by Medicare, allows visits to be delivered by smartphone, real-time, audio, video, interactive in lieu of other, let's see, interactive capabilities, and then it says, and removes the requirement that providers of telehealth services have treated the beneficiary receiving these services for a year. A separate provision allows federally qualified health centers and rural health clinics to provide telehealth services to Medicare beneficiaries during COVID-19 emergency period. So you can be a brand new patient, and somebody could see you by telehealth, and they could bill as usual.
Great. So it sounds like if you're needing a local pain doctor, you should, try to call around and see if maybe they're doing telehealth and accepting new patients, because there's technically nothing prohibiting them from taking you on as a new patient.
Correct. They're going to want, previous records.
Right.
If you're transferring from another doctor. But I mean, you could be a brand new pain patient. Maybe you never have seen anybody, right? And that will I think that would make a pain care provider more squeamish. And they may want to see you, but that's okay. If they say, I need to see you at least one time, and then we can do it by telehealth. I understand that, particularly because people are being so highly scrutinized with opioids these days, both patients and providers. Yeah.
Okay. Great information. And we just had someone else just commented that your advice about the out-of-state prescriptions was really helpful to them as well. So another question we have is this person saying that this is a live question they just asked a couple of minutes ago. They said that, I heard if you were on pain medications, you will need to start going into the office next month. Do you know if this is like a federal regulation or something that sort of varies by doctors' offices?
So the federal regulation is very clear. A doctor, any place in the country, can write for a 90-day supply. But the way it happens is they have to write 3 separate prescriptions, each for 30 days, and it has to be dated. Each prescription has to be dated on the date that it was written. And on each, so it'll be the prescription for today, and then on each subsequent prescription, it will say this is to be filled on this day. And this one is to be filled on that day. There are regular around COVID that has actually lightened up some of the early fill within certain parameters. So you can actually get some of these things filled as long as they meet those certain parameters. So yeah, I mean, I think that these things should not be a problem.
Okay, good to know. And I'm assuming, so it is sort of a, doctor's case by case and depends on the clinic and center as far as.
Well, it depends on, well, I told you what the federal law was,
right?
But states vary.
Right.
And one of the things I dealt with was that state law and federal law, of the two laws prevail.
Okay.
So if the state come up with emergency pandemic guidelines and that does not allow 3 prescriptions to be written, maybe that state only allows a 2-week supply. States allow at least a month's supply if there's a code put on prescription that designates that the patient is taking these drugs for a chronic disorder. So most, not all, but most states do allow that. But again, most states have got guidelines in place. And if you go to the state, just go to Google and type in North Carolina state regulation, COVID-19 controlled substances.
Okay.
Take out North Carolina and put in whatever state you want. Right up. Every state has been required to have some kind of website. So you can easily find it on there.
Okay. All right, great to know. That's great information to know. So something else that someone has just asked, and I think this kind of touches on, the challenges of communicating virtually, perhaps. And the question is, how can people get their doctors to believe the severity of their pain? So perhaps they're worried they can't quite effectively communicate it virtually. And maybe you have some recommendations for getting your point across online.
Well, I think that you have to use descriptors. That helps clinicians because we've all heard descriptors, right? Like, it goes both ways. And not only is it difficult for the patient to express to the provider what their pain is, it's difficult for the provider, the patient understand what we need to deal with. So for example, I'll say to a patient, how bad is that pain on a scale of 0 to 10? You've all heard this, 0 being no pain and 10 being the worst imaginable pain. They're like, oh, it's a 12. And if it's a woman, I always say to the woman, have you ever had children before? So we're going to call childbirth a 10 at the worst, at the worst absolute moment. And if it's a man, I'll say, listen, if I was to take a hot iron and place it on your tongue, that's a 10, okay? Now I realize one person's 10 is not another person's 10. And that's why using a numerical scale is not 100%. And that is also why what I'm about to tell you is important. You need to tell a provider, it feels like something ice on a sore tooth. It feels like somebody's sticking a knife in, but not just sticking a knife into my belly, but that they're twisting it. It's that jabbing kind of pain. But you also need to tell them how it's affected your life, because somebody may have pain 8 out of 10 and they're out cutting the lawn, right? And they come in the next visit and I'm like, oh, how's your pain? Well, it's 6, but I'm feeling pretty good. Well, 6 seems like a lot to me. Well, yeah, but I'm able to do more things now that I couldn't do before. So you need to be very descriptive. Tell them, is it a hot shooting, burning pain? Does it feel like there's somebody's taking a pick that's cold and sticking it in a certain spot? Those kind of things are very, very helpful. And then also tell them the things that you can do, the things that you can't do, and the things that you want to do. Because a lot of providers are so wrapped up. I mean, and it's not all the time. They got 15 minutes. They're treating your hypertension, your blood pressure, your diabetes, your thyroid disease, You know, God forbid they should ask you about constipation from opioids because, you know, they're afraid if you say yes, then now they got to deal with that, right? So, or you may be afraid to bring up constipation because you're afraid they'll adjust your medications. So there are all these things, but you really need to be open and honest and explain exactly these things with the.
You just cut out a little bit there. Well, let's see. Is anyone else? Is Dr. Fudin cutting out for anyone else, or is it just me? I'm hoping he comes right back. Let's see here. Okay, yes. We got a couple yeses from folks. Okay. Dr. Fudin, I don't know if you can hear this, but you just cut out and froze, unfortunately. So we will just wait a second and see if he comes back. But just to finish his point, hopefully it's just a little glitch and he'll be back in a moment. Oh, okay, he got logged out completely. But let's just wait a couple minutes and see if he's able to rejoin. But I think that his point about talking about how your pain is affecting you is a huge one. I know that our CEO, Nicole Hemingway, talked about that in an interview with Practical Pain Management recently, about how important it is that you speak to what pain is preventing you from doing, because sometimes that's, you know, the best way to kind of make it real for a person and help them understand, you know, the ways that it's limiting you. I'm just going to check in with Dr. Fudin via text. Let's see here. Thanks for your patience today, guys. I'm hoping everyone's finding these answers really helpful. I know that I am. We have a couple more questions I'm hoping we can get to. So fingers crossed that he's able to come back. Technology is a wonderful thing, except for when it stops working on us. So let's see. And we do have some more questions coming in too. Let's see here. Okay. Great questions. I haven't heard back from him yet, but I'm hoping he's able to just pop back on. So keep thinking of questions if you have them. Worst case, what we'll do is we can maybe email him some of these questions as well that we didn't get to answer. And we can try to maybe post those online or, you know, a blog post or something like that, because these questions have been really insightful. And, you know, his answers have been super helpful, but I think a lot of us have these questions about telehealth. I know that I haven't used telehealth yet, just because I'm kind of unsure about it. So I wonder if other people are feeling the same. And we have some questions about whether telehealth costs the same as an in-person visit, which I think is a good one. My understanding is that yes, it does cost the same, but I also know you may have to check with your insurer directly because everyone's different. I also believe that Medicare is covering telehealth, although again, definitely have to check directly just to be sure. Let's see what other questions we have that we might need to save for next time or for maybe a post on our blog. Another question was about asking for an increase of your medication without raising any red flags or jeopardizing your current prescription access. I think that is a tough one because even as we're learning about all these sorts of the rules and regulations and sort of what our rights are, it can be really difficult to, you know, kind of advocate for yourself in the doctor's office setting without worrying that they might take it the wrong way. So that's definitely a great question. I'm trying to see what else we have here. Someone's saying they think that their insurance has actually cut back on telehealth coverage. So that's definitely something else that is not great. So Dr. Fudin seems to be having trouble rejoining. So I'm going to try one last thing. Let's see here.
Hi, Emily.
Yeah.
This is Nicole Hemingway.
Okay.
I just sent Dr. Fudin a link. He was having problems accessing it to get back in. So hopefully that will work.
Okay, All right, great. Well, we'll keep hanging tight. Thanks for those of you who are still with us and haven't given up yet. So hopefully just a few more minutes and we'll see if he can rejoin. I know he was cutting out like a little bit here and there before, but I'm surprised he got it totally kicked out. So hopefully he can rejoin now that he has that link. Nicole, something else that you might be able to try, Nicole's on the back end doing some tech help. You might be able to try inviting him directly from like the, oh, here's Nicole. You might be able, oh, there he is.
I'm back.
Oh, hi.
Sorry for that.
Oh, no worries. No worries. For some reason, it's labeled you as Nicole, but we know that you're Dr.
Okay, I'll be Nicole. She's nicer looking than I am.
Man, technology today, I'm telling you, it's been quite an adventure. But frankly, we were concerned we might not be able to have this webinar at all because Zoom was having so much trouble. So I'm just grateful that it's working. So
yeah.
welcome. So we've been talking about some of the questions that have been coming in, and people have been saying, you know, just how helpful all this information is. So we have about 10 minutes left, so we'll get to just a few more questions. So let's see. So one of the questions that I thought was really good was whether the bill for telehealth is the same amount as an in-person visit.
It is now. I mean, you know, that could change, but Medicare is paying the exact same amount. Before certain insurance companies wouldn't do that, but now they are. And, you know, it could change, but yeah, same thing.
Okay. Do you recommend that people like check in advance, or is it like pretty across the board that insurers are covering telehealth?
I mean, I would check.
Right.
It is pretty much across the board, but the last thing you want to do is get with a huge bill thinking that it was covered, and it's usually just a simple phone call.
Right. Right. Okay. Good to know. Another question we had actually gotten before that was emailed in, but ties in here though, is whether Medicare is also covering telehealth, you know, as well as they do.
Yes. And certain Advantage plans have flexibility to waive certain requirements with regard to coverage because of the disaster plan with COVID-19. So they absolutely have. There's a provision in the CARES Act that requires Part D plans, both the standalone plans and Advantage plans, to provide up to 90 days of covered drugs. So yeah, Medicare's on top of it.
Okay, great to know. A couple other questions about medications. Someone asked about, and this is maybe, I don't know if it's really telehealth specific, but about asking for an increase in medications without raising red flags or jeopardizing your current prescription. If you had any tips for that.
So certain states used to require live.
Uh-oh, cutting out a little bit again. Oh no. I think can you guys type in the chat and let me know if he's cutting out for you as well? I'm assuming it's the same difficulties. Okay. All right, darn it. So, Dr. Fudin, I don't know if you can hear me, but you just froze again. So I'm going to send you a text. I think that what the universe is telling us is that we've done, we've covered a lot of questions here. But what I think that we should do, because I know a lot of you still have questions coming in, as someone just said, they were really excited for his answer to that question specifically. So what I think we'll do is we will put together some of these questions and ask Dr. Fudin to write down his responses, maybe in the form of a blog post on our blog, which is called Remedy. And we will get you guys information that way, because I know this is such a big issue for people. And Dr. Fudin is so helpful and has such great advice, especially for dealing with some of these really nuanced situations. So obviously, again, he can't really answer like specific medical questions, but we can kind of synthesize your questions that you've had and put together some advice on those. So thank you guys so much for sticking with us. I'm so sorry about the technical difficulties that have kind of cramped our style with only 10 minutes left to go, but I hope that you found the first 40-45 minutes helpful. And I did just want to share my screen one last time. So let's see here. Hopefully everyone can see my screen. I did want to point you all to some other resources that US Pain has for answering some of these questions. So one is our information center about COVID-19. We're calling it the COVID-19 Information Center. So it has some information about COVID itself and symptoms and that sort of thing. But it also has a lot of information about continuing to access care during COVID. So like we have links to like the DEA's policy. We have some links to different Medicare policies. So definitely recommend checking that out. Also, thanks to you guys, we got a lot of great data about how COVID-19 is affecting chronic pain and how it's affecting your access to care. So if you're interested to learn more about that data and sort of the trends that we saw as far as the roadblocks you're facing and also our recommendations for how to fix them, which include keeping telehealth as an option long after COVID-19 is hopefully a footnote in our history. That's the link to check that out. We also recognize that right now, like there's a lot of stress and anxiety that, we normally have as people with chronic pain, but it's now amplified because of all that's going on. So if you find yourself needing some extra support, definitely check out our online support groups. We offer them online and also over the phone. So go to painconnection.org and check those out. And then finally, I'd be remiss if I didn't plug our Pain Awareness Month campaign, which is coming up in just a week away. Oh my gosh. So keep an eye out for information about that. We're going to be focusing on barriers to multidisciplinary individualized care and doing a lot of education around multidisciplinary options for people with pain and trying to draw some attention to the challenges people face in accessing really high quality pain care. Often people tell us you should be doing massage and PT and all these other things, but the truth is, we can't afford them. They're difficult to access for some reason. We have trouble driving, so we're trying to bring some attention to those issues. So keep an eye out for that. We'll be sending out a big email later this week with all the details about how you can get involved. And we have some cool prizes and different events going on. So definitely stay tuned for that. So again, thank you. Thanks for your patience. Sorry we had to end a little early, but like I said, we will work on getting some written answers from Dr. Fudin to the questions that you had. And feel free to email us if you think of any other questions. We'll do our best to get to those as well. And lastly, as always, this is one of our special events in our Pain Education Portal or Pep Talk series. If you're interested in future events, just go to our website, uspainfoundation.org/events and see what we have coming up. So thanks again, and thank you to our sponsor, Salix. We really appreciate you. All right. Take care, guys. Have a good rest of your day.